So we all came to this chamber under the impression that we were serving in the New Jersey General Assembly. After reading this bill, I wasn't so sure. This legislation reads less like state policy, and it reads like an application for membership in an international public health community. The bill starts with kind of an odd premise to begin with. It tells us that the federal government's withdrawal from the World Health Organization created what the sponsors describe as, and I quote, a void in World Health coverage. My question is simple. When exactly did filling a void in World Health leadership become the responsibility of the New Jersey Department of Health? Is our recent very public examples of strong health-based oversight what drew us to this or drew them to us? I mean, if you look back at what's been happening, let's say, predated some of us in this chamber, but what had happened during COVID in New Jersey, the state just agreed to a $53 million settlement with veterans and their families arising from those tragedies and the ridiculous oversight that did not exist coming from the Department of Health under the lady who needed no introduction, whose name is now on a building, shamefully. The Department of Health is responsible for oversight involving infection control, inspections, reporting, and public health compliance. Then years later, Sussex County is still fighting to obtain records from the Andover subacute tragedy that was also for a communicable disease outbreak, a pandemic. They were under the watch of the New Jersey Department of Health. We continue to rank among the worst states in the nation for maternal health outcomes, and the WHO actually oversees some of that from a global standpoint. Now, we have one assembly person in this chamber who does a really, really good job addressing that for here in New Jersey. That's my colleague, Assemblywoman Spate. She deserves much respect for her efforts in that regard, but we are not yet at the point of being world leaders for this issue. So despite years of legislation, initiatives, studies, commissions, and whatnot, we got a lot of problems here in New Jersey. So forgive me if I'm not convinced that New Jersey is hardly the natural choice to help fill a void in World Health leadership. Under this bill, the Department of Health is authorized to communicate and coordinate directly with the Global Outbreak Alert and Response Network. We are to travel or participate in international training exercises, consultations, engage in information sharing activities, and provide recommendations for participation in additional international public health initiatives. We have agencies here that are struggling to answer the phone or communicate across the hall, but somehow our Department of Health here is going to communicate across an ocean and continents with all of our expertise, and maybe that's what I keep getting stuck on. I'm extraordinarily confused that somehow we ended up here when even the Biden administration went on record saying the WHO was not a reliable or effective organization to handle the pandemic. We know countrywide, New Jersey was one of the worst in responding to the pandemic due to the deaths, due to the long extended draconian shutdowns, which, by the way, many of you were against and chose to not override the prior governor's vetoes. So my question is, we got a big mess here. We have a mess right here in New Jersey. Why we somehow think we are the moral or health authority to join a couple other states, New York and Illinois, and then here comes New Jersey, the expert. I think this is so silly. I do not want to pay money to put our Department of Health on a plane and fly them halfway across the globe to deal with global health initiatives when we have a cottage baking industry here where they can't even get those applications through for someone baking cupcakes in their kitchen. We are not solving the world's health problems. Thank you.